You talk about testing. Could you tell us what type of battery of tests would take place here? I'm a patient, I'm worried about memory loss, I come in through the front door. What can I anticipate?
The first set of tests are called memory and cognitive performance tests. They include approximately 45 to 60 minutes of questions. We ask you to remember lists of words. We have you do some simple calculation. We ask you to recognize certain animals. We ask you to draw a certain shape. We ask you to draw a clock, put the numbers in, put the hands at a certain time. These questions, in combination with other tests, help us determine if your memory concern is normal for your age and education or below what is expected for your age and education. If in fact we think you have the signs of mild cognitive impairment, we ask you to consider undergoing tests, either here or with your neurologist or your primary care internist or family practitioner. And those can include blood tests for the vitamins we talked about and thyroid levels, as well as your kidney and liver function. Very simple tests, blood tests. We also would recommend a brain scan, of which there are two types. One images the structure of the brain, and that's called an MRI, magnetic resonance imaging. The other one, which is a more sophisticated test that can help us determine if your MCI is likely due to Alzheimer's or not, is called a PET scan. This PET scan will show if a patient has what we call amyloid plaques or has a decrease in activity in very vital areas of the brain. There are two forms of PET scan. One looks at the plaque and one looks at the activity of the brain. Those are just some of the tests we would recommend for those who have cognitive impairment of a mild or moderate degree, as well as those who have a diagnosis of dementia that need to know, is it or is it not Alzheimer's dementia?